Hi, Bruce here from New Jersey, 9 days after sinus surgery. Just want to share a few highlights from my experience. If you're considering sinus surgery, it's difficult. There's a lot of anxiety involved. There's concerns about picking the right doctor, about the recovery. Do I really need it? Should I suffer it out? Do I want drilling in my head? And all those fun thoughts. So after a 3-month sinus infection, 4 antibiotics, and it was not completely resolved, and some ongoing sinus issues over 10 years, I opted for the surgery. I picked a doctor I was of several opinions that was on the younger side. I thought he had the best credentials, and a perfect choice, you never know for sure. But I was comfortable enough to go with him, went for the surgery. The most important part of the surgery for me was the fact that he does not pack his patients. So if I had to go in there and get packed in my nose and deal with a week of not being able to breathe and sleep, I probably would not have done the surgery. So when they told me that he doesn't pack any of his patients, of course, unless there's a real problem or a real reason, that was really important to me. So find a doctor that does not do packing. And so I went in for the surgery, all the usual prep. The week starting, a few days before, no Advil, night before, no eating, no drinking, full anesthesia, breathing tube, and out you go. So while he was in there, he did my ethmoids, opened everything up, scraped, got rid of mucus, got rid of some infection, did my septum a little bit. And generally what they do is they go in there and do everything because they want to give you the optimal chance to recover and not have ongoing issues. So when I woke up from the surgery, I was able to breathe, really important. I had a mustache bandage on me to catch some blood drippings. The blood really wasn't too bad. I was able to go home, and I was able to breathe. By that night, I was congested. They say you can have some rebound congestion. So I was congested that night, and starting the following day, you start 3 nasal rinses per day. And by the second nasal rinse, I had broken through and got a lot of blood and scabs and all kinds of crap came out. You don't want to push too hard, but then I was able to breathe. The bleeding was minimal. The worst part about the first few days of the recovery was how sore and uncomfortable the bottom half of my nose was, the septum area. That really has a numbing uncomfortableness to it, and it's more very uncomfortable than extremely painful. The top half of my nose, this part of my face, the top part, really didn't have any pain. It was all mostly in the septum area, a lot of discomfort. They don't want you going in and touching and digging and putting ointment, but I put a little ointment. I did some nasal sprays. I tried to manage it a little bit. You don't want to pick on, there's a running stitch up your septum. They don't want you touching that, even though they tell you it's one stitch. It's more like a zigzag. So really, you have to sleep on an incline. You have to go through your nasal rinses. You're going to have a lot of things going on in your nose, and you're going to have to manage the discomfort. I would say discomfort more than really bad pain. Well, the first day, you feel like you were punched in the face by Mike Tyson, if you want to be honest with you. But as long as you can breathe and you're not packed, I feel like it's manageable. So I did the surgery. I am now 9 days after surgery. I went for my post-op. They cleaned me out a little bit. I'm certainly better than I was for the 3 months before the surgery. But before I got that 3-month sinus infection, whatever my normal was, I can't quite say I'm back to that because I'm still recovering. There's still some minor congestion issues, inflammation issues, swelling issues. Certainly, sinus surgery takes more than a week or 2 weeks to fully recover and get the swelling down, especially if they're dealing with your septum. But find a doctor that does not pack you. Look into their credentials. Really important. When I went for my first visit with him, he did a culture to see what we're dealing with, and he's the first ENT to do a culture on me. And he also did not rush me into surgery. We tried multiple antibiotics, steroid sprays, steroid rinse. We tried to manage it to the point where we felt that surgery was the only option. Then I went for another opinion or two, decided to use them for the surgery, and hopefully it'll continue to heal and wind up being a good decision. But so far, It's been the right decision. I'm able to breathe okay. Okay to good. Sometimes I'm breathing so good it's kind of weird because I actually don't feel myself breathing. That's a new experience. So find a doctor you're comfortable with. Ask a lot of questions. Do not go for the packing if you don't have to. And good luck to you.